Welcome to Healthcare at the Edge, where we explore the intersection of healthcare and technology. My name is Samuel. Today I want to talk to you about the COVID-19 vaccine. And you might think to yourself, what does this have to do with technology? We know it's long hoped for. A lot of people have placed really a lot of hope in getting a vaccination to potentially return, what we've known to be normal about the world. Who knows what things will shake out. And a lot of people have, been signing up to get their vaccine and wondering about it. And that's where the technology comes into play is how our health systems using the technology they have, the data platforms, the websites, the applications, the different ways of communicating with their users and customers and patients to communicate the story of their vaccine and how many shipments they're getting, what's available, who's available, the guidance from the CDC and WHO. We have all this information, but being able to communicate, take the information and then communicate it in an effective way. That's very challenging for a lot of healthcare organizations. And so we've got to get on the ball about being better at communicating to our patients and customers in our markets. Secondly, I found it very interesting today seeing the news around this kind of consortium that's coming together for the vaccine digital health passport, where Microsoft, Oracle, Salesforce, Cerner, other big tech companies all coming together for the purpose of creating something that users can have that will document and reflect their vaccination status. What's concerning about it in some ways is that healthcare hasn't been able to do this themselves. They don't have the muscle or the know-how to be able to pull off delivering a real user-friendly way of ingesting health information and using health information. So they do rely upon tech companies to do that. And so that's where that partnership comes together. So they've got the right people at the table, that's for sure. Microsoft and Salesforce and Oracle, they know what they're doing when it comes to taking really wide areas of data and then bringing them to a fine point and communicating that. And some people might say this is going to be wonderful. Having this health passport would be a great idea where our communities can get back to normal and we can all kind of, trust and know that everybody's, had the vaccine or anything like that. But those are people that would be, pro-vaccine, and those that are not vaccinated or do not want to get the vaccine, which there is a significant portion of the population that has had a lot of doubts about why they need the vaccine, how safe this vaccine is, or different things. I mean, we got to understand this vaccine is an emergency use authorized vaccine. We don't have a lot of long-term data on it. The initial data looked good and we get it going and maybe get things back to normal. But we don't have long-term data. There are a lot of questions still about this vaccine or even the mRNA technology in general. And so the use of technology to enforce mandates or other things that might come down from health organizations or governments, it's a very interesting kind of ethical question in some ways. So those that are for the vaccine would say, yes, absolutely, I can document my status, I can get health information readily at my fingertips, and that would be very positive indeed. Those that would be against it would say, I don't have confidence in the vaccine and I don't want tech to be used to limit my ability to interact with community and be out in the world and live my life and make my own medical decisions. And so a lot of conversation and questions happening right now. I'm curious what your thoughts are on it, because this is a very big, sticky issue. And unless we have intelligent, reasoned, and ideas that are being floated amongst people, we're not going to make headway on this. It's not as simple as, just get the vaccine. And it's not as simple as just don't get a vaccine. There's something in the middle that's going to be more important as we navigate a long-term health future. So let me know your thoughts. The COVID-19 vaccine, it's a big deal in our world right now and a lot of conversation happening. And I'm really curious to hear what you think about it. Let me know. What do you have? Comments, concerns, challenges, or critiques? Put them in the comment section below. Healthcare at the Edge is written and produced by Samuel Hill.